ePROMS-MEL project is a pilot study trialling the implementation of patient-reported outcome measures into routine clinical practice. It will be conducted in several surgical and medical oncology melanoma clinics at MIA and RPA with Robin Saw as lead clinician. It involves the recruitment of 120 patients with stage 3 melanoma. The literature suggests that approximately 30% of melanoma patients experience moderate or higher levels of psychosocial distress and/or problems with quality of life. Consenting patients will be given an iPad containing the set of study questionnaires by the clinic nurses while they are waiting for their routine clinic visit. The majority of patients are expected to have minor levels of psychosocial distress and will complete the first questionnaire only, taking around 3 minutes of their time. Patients who have questionnaire responses indicative of higher levels of psychosocial distress will be automatically presented with a further 4 questionnaires to provide more information about issues they are facing. These may take an additional 20 to 25 minutes to complete. Demographic information will also be collected from the patient at their baseline visit. Patients will be asked to attend the clinic 15 minutes prior to their scheduled appointment. A questionnaire report will be automatically generated and emailed to the patient's treating clinician and to the patient as well if they request it. This report will contain the patient's score for the distress thermometer and any problems they identified from the patient problem list. The project officer will liaise with the clinic managers to organise the recruitment. You will have the opportunity to veto the enrolment of any patients you believe are not suitable to participate. Your role begins when the clinic manager gives you a hard copy of the report shortly before you're due to see the patient for their routine follow-up appointment. You will need to record the referral details on this form and return it to the clinic manager. For patients reporting minor levels of distress, that is, with a distress thermometer score between 0 and 3 out of 10, you can reassure them that they appear to be coping quite well at the moment and that we will continue to monitor how they are going at their subsequent appointments over a 12-month period. For patients who have reported responses indicating psychosocial distress and/or poor quality of life, a score of 4 or more on the distress thermometer, you have the opportunity to ask them more specifically about these issues. The CNCs are also available to speak with the patients, and we encourage you to use this valuable resource. Depending on the patient's responses and your clinical knowledge, you may decide to refer the patients to some support services. A directory of support services is available on the MIA Education portal at melanomaeducation.org.au, and a hard copy of these resources will be provided in a study folder in each of the clinic consultation rooms. If you do make referrals, please check with the patient that they are happy for you to send a summary of all their questionnaire responses to the support service provider. It will be important to include a reminder to ask the patient at the next visit if the referral of support services was helpful. For subsequent appointments, the questionnaire report will include graphical representation of how the patient is managing over time. At the end of the study, you will be asked to complete a short questionnaire on your views of the project. You may also be invited to participate in a short interview with the project team. Thank you for your interest in this study. We look forward to working with you.